Hi, my name is Dr. David Scratchley. I'm a psychologist who works in Seattle, Washington, where I study the condition of addiction. I treat individuals who are addicted, both adolescent and adult, and I'd like to today share with you a little bit about prescription drug misuse, addiction to prescription drugs, and some of the dangers associated with this particular condition. And to do that, I actually have a presentation, and the name of the presentation that I'd like to show you today is OxyContin, Vicodin, and Xanax. I'd like to invite you to go to my website, www.drugseminars.net, where for no charge you're welcome to download and use this presentation as well as other videos and presentations I hope you find useful in terms of coping with the condition of addiction. So to begin with, when we start to talk about prescription drug use and misuse, it's very important we realize that there's a lot of confusion because on one hand, here's a medication that has been prescribed by a doctor to somebody, so it's easy for us to get confused and think that this drug is not a risk. Some of the people who have fallen prey to this exact type of logic include the late great actor Mr. Heath Ledger, who died as a result of combining a whole host of different drugs together, OxyContin and some sleeping aids, and really he probably, from what I have read, was struggling to fall asleep, but at the end of his life, shortly before he died, he was actually sleeping about 45 minutes a night and was seen in sort of the psychotic delirium wandering around Manhattan. And of course, he's a great actor, and I think a number of people identify with his death as being a hallmark of the dangers associated with prescription drug use and misuse. But much more commonly are the stories like this one I found in the Dallas Morning News of a woman who lost her 18-year-old son after he apparently overdosed on maybe Xanax or Valium and a painkiller, OxyContin. Fortunately, although people like Heath Ledger do die, it is much more common that the people who die are just average citizens, often young people who get involved with drugs that come out of people's medicine cabinets, and people don't recognize the danger that literally tens of thousands of people will die from drugs that have been sitting in the medicine cabinet and somehow get diverted into our communities. So when we start to look at this, we realize that this is actually a very, very serious type of event. Now, there are a number of different drugs that people use in this category. We'll be talking a little bit today about some of the painkillers like OxyContin and some of the sedatives like Xanax, but we need to realize that the harmful effects associated with these drugs come when people use them in unorthodox ways or ways that they weren't intended. So for instance, with OxyContin, time-release form of the drug OxyCodone, when people grind it up, they defeat the time-release mechanism, get all the drug all at once, get this monster dose of drugs, and end up overdosing. So it's through the misuse and violating the terms of the dose, how it was meant to be used. In other words, what was the dose you were supposed to take? People take too much. How often was supposed to be used, the schedule of use, maybe one time or 3 times or 2 times a day, and maybe you're doing it 10 times, or the route of use. In other words, if you're supposed to swallow the drug, then if you're smoking it or you're snorting it, you're in real trouble. Now, with the prescription painkillers, we discovered that one of the most serious is OxyContin. Here's a picture of OxyContin, and sincerely, at $1 a milligram, an 80 milligram pill of OxyContin is $80. And so when people get addicted, I've seen people with addictions that cost upwards of $600 or $700 a day. It is a very, very serious condition, and of course when they chew or they inhale this, or some people smoke or shoot it, they get all the drug at once, and it's quite possible for you to end up in the emergency room or dead very quickly from using OxyContin. So when people are using this, they need to get into care right away. We need to find a way to get the drug safely out of their body, and we need to help them to keep it out of their body through either a treatment group or perhaps working with their doctor for some type of medication to help with this. Now, there are other painkillers that people use. For example, Vicodin, hydrocodone, is also extremely popular, and we've seen the number of emergency room visits just skyrocket since 2000, when people started to really pick up and use several of these prescription medications in this both illegal and ill-guided manner. Now, there are other drugs like morphine and methadone that people get involved with that also can be very serious when taken and result in literally thousands of deaths. So if we were to take a look at this, what we discover then is that there are many types of prescription painkillers available, and when people get involved with these drugs, often what occurs here is that they become addicted and they discover the price of the addiction is so much that they end up switching to a drug, something like heroin, which is just as powerful but costs much less. So if you're using something like $800 worth of OxyContin and you can't keep up with that, or $400 or $200, and you get involved with heroin, suddenly your bill drops to maybe $80 a day. But of course it comes with terrible, terrible conditions of abscesses from using the street drug, the danger, of course, of getting an infection that that causes you to die or is fatal, the possibility of getting contaminants, or ending up in the illicit drug trades where you might be a victim of violence. All of these things are very real parts of the use of a drug like heroin. Now, there are other drugs that people use that are prescription drugs, and very popular are the sedatives. These are drugs that produce an action in the nervous system that is similar to alcohol, ethyl alcohol, the alcohol we use when we drink beverages. And people take these to become relaxed enough to sleep. And what we find is that tolerance develops very rapidly to these compounds. And what we call in the profession of pharmacology or psychopharmacology iatrogenic use of the drug, where the person starts to go ahead and use the drug when they feel like it instead of when they actually need it. The person gets into a situation where they can have life-threatening withdrawal. So we need to be very concerned if somebody is addicted to a sedative hypnotic, something like Xanax or Valium or Ambien. All of these can cause real problems. So there's several issues related to this, and when we start to see people getting involved with these compounds, we call them anxiolytic compounds. What we discover is that the tolerance a person can develop is absolutely life-threatening. Again, back to Heath Ledger, who was seen with a 45-minute sleep pattern a night, yet taking 6 different types of compounds to try to attain that. That's exactly how you get in a situation where, in fact, he could die. Now, one of the most popular types of sedative hypnotics is Xanax, and Xanax is, of course, widely available. There's an estimated 5 million people who take Xanax to cope with anxiety, and we discover that it results in tens of thousands of emergency room visits, but even more so when people mix this drug with alcohol. The effect is just so powerful that the person can get into a situation in which he or she cannot cope with that and can end up overdose very, very easily and end up driving in such a way, for example, that they crash a car or end up getting in some other type of accident. So I'd like to close my discussion today by telling you that when we start to talk about the issue of addiction to prescription drugs, we need to recognize it is truly one of our most serious forms of drug abuse. It is a skyrocketing form of drug abuse in the United States today, and that many of the people who use these drugs are younger people who get the drugs from their friends, who get it from their parents or neighbors or friends' medicine cabinets. So if you have these drugs in your medicine cabinets, get rid of them. Right now there's a huge drive to have people turn in excess or old and unused drugs. Many police stations and certainly the DEA and many even pharmacies and other places have these programs going, so avail yourself of them. And please visit my website, www.drugseminars.net, where you can download for free this presentation, and thank you for listening.